And we're also gonna record. Okay. It says that we are live streaming to Facebook. Hey, Kim Everett, back from your vacation. How are you?
Hello, Dr. Ardella. I am good, thank you.
Good. So, what's new? BCHIP survived without you for a week?
They did, yes. They more than survived. They did a great job. The team kept things moving along quite well, so it's
As one
great.
would expect with your fabulous team. I was kind of making fun of them there. But so we are here today to talk about a brand new initiative in the Bucks County area, brought to the table by one of our senators. The initiative is Blue Zones to create a healthier Bucks County, and you are going to take it from here because BCHIP is at the center of it. And I'll ask questions when we need to. How's that sound?
Well, I appreciate it. Thank you. So yeah, we are really excited. Senator Santarsiero identified blue zones as an opportunity for Bucks County, and BCHIP has been identified as an integral partner for the project. So I'm sure there are a lot of folks that are saying, what the heck is a blue zone? And so I will tell you, if you're really interested, there's a Netflix documentary. So for anyone that has Netflix, you can go on Netflix and watch a documentary around blue zones. Blue zones, Dan Buettner was with National Geographic Explorer and fellow and journalist, and he started searching. There was areas around the world that he saw that life expectancy or longevity was higher than other places. And so did some research around why. And so there are places around the world, like locations in Greece or Japan, or there are a few in the United States as well, where people live long, productive, healthy lives. So we're not talking just someone who's living for the sake of living, but living long, productive, healthy lives. And so they wanted to identify what were the things that were contributing to the success of those communities, and were they things that could be implemented other places. And so the things that were identified, and I'm becoming familiar with blue zones myself. I don't want to act like the expert. So if the blue zones folks watch this, I'm hoping that they're gracious
They
with
can
my
come on.
description.
They
Yeah,
can come on with us next time. Come
but
on in.
this is true. We need to get them on for sure. But what's really key is that you have, of course, a sense of community, I think is what is very important. And they found that regular exercise, but being incorporated into lifestyle. So in other words, maybe it's not exercise, but your
Wait,
community
hold
is
on.
focused around encouraging folks to do that.
Okay. Kim, you cut out
Okay.
there for a minute.
Oh, sorry.
So we heard exercise and then you garbled a little bit.
Okay, that's odd. Sorry about that.
That's
So
okay.
it's really about having a sense of community and being able to incorporate opportunities for movement. Maybe exercise isn't the right word, but for
Okay.
movement. So having paths available, incorporating, walking to work or biking to work, or just being able to walk to the grocery store, or having more access to movement, I think is something they found was really important. Also having access to healthy food choices.
Oh,
So not saying that we, can't eat some things that might not be so healthy every once in a while, but that having access to healthy food choices is really important. And we know that there are areas of the community where we have food deserts and things of that sort, that people just don't have access to the food that they need. And so healthy food choices was important. And then the other piece of it that I think is so important, because BCHIP is really involved in the mental health work here in our community, is having a sense of connectiveness.
mhm.
And so when we talk about mental health needs, we know that prevention is important. Well, I'm all about having resources for people who need them, that are having challenges with mental health. Boy, it would be really great to do some work on the prevention side. And so this connectiveness could be whether it's, somebody that neighbors gathering, or having, places to reach out to get together, having ways to connect, whether it's by phone, if you needed to, But trying to just make sure that people know there's always someone out there they can talk to or that they can spend time with.
So important because we don't do that anymore as, in communities, block things like even like block parties.
Exactly.
And many people know that I recently moved and it's getting hot. And, what is the news telling you to do? We've been posting about it for BCHIP. Check on your neighbors. I'm like, they haven't said hi yet. Sorry, neighbors. I'm throwing you under the bus here. But, I'm like, wait a minute. We don't even know our neighbors anymore. And so that sense of community. And I think one of the great things about BCHIP is that we are constantly putting out information on ways that Bucks County residents can be connected, right? Whether it's through NAMI Bucks, who runs so many support groups, as well as the Y has that program. And by the way, Kim is the one that has alerted me to all of these things because she is so well connected in Bucks County. But the Y has, I think it's called the PATS program. So if you're a veteran or you're a mom, or there's plenty of opportunities for you throughout the weeks and months of, around the clock, annually, to get out there and connect in with people.
Exactly. And so we know those things are really important. And so what's neat is Blue Zones really came up with I mentioned the first three, but it's called the Power Nine is really what they came up with. And I mentioned the moving naturally piece. I mentioned the belonging or the connectiveness. Loved ones first is another piece of it, making sure that, family and things come first, having the right tribe, having people around you that lift each other up. Wine at 5 is another one, which I think Jen, you and I will both agree that we would love to do. But again, that's that sense of connectivity, which I think is important. Plant Slant is, making sure that we have a more plant-based diet. So we talked about that, having a healthier diet. Downshifting, so having time for just true intention of quieting your mind, quieting your heart, quieting your soul, and having a sense of purpose. And so I don't, certainly folks can go onto the Blue Zones website. It's bluezones.com, and they can read more about Blue Zones. But just to talk a little bit more about it locally, there's different phases of the Blue Zone project, and we're not exactly sure where it's going to lead. We're kind of waiting to see. But the first phase is called the Ignite phase. And what they do is they spend 7 or 8 months doing a extremely comprehensive assessment of our community. So right now we're focusing this work on District 10, which is the Senator Santarsiero's district. I have all intention of hoping to roll this program out countywide as we explore it. But right now, since Senator Santarsiero initiated this project, we're focusing on his district.
So what towns does that include?
Oh, I was afraid you were going to ask me that. So it's kind of weird. If you look at the map, the district map, it's from like there's Falls Township, and then there's New Hope, but it goes all the way up to Percy. It's kind of like a
Oh, you did a great job.
C. It's like a backwards C of the county.
That's perfect.
So yeah,
Okay,
so it's
got it.
really unique. It doesn't include where I live, but it's because Frank Ferry is our other senator. He has the other district.
Okay.
So it doesn't include that district, but again, hoping to bring it forward because I know I've also spoke with Senator Ferry, and he's very interested in the work. And so we're hoping to incorporate his district after we get through some of the initial stages of this. But the first phase, they call it, is this Ignite phase. And what they'll do is we have a lot of assessments already. I tell everybody, truly, I typically think we don't need many more assessments, but this one's pretty comprehensive and a little unique. We have our community health needs assessments that the hospitals do. Right. Our community benefit organizations do a community needs assessment, like Bucks County Opportunity Council. The county has an assessment and a plan that they did, something 2040, which is on the county website. So what Blue Zone's going to do, and that's looking at like parks and roads and trails and all that kind of stuff. So what Blue Zone will do is they will come in and they're going to take all these assessments that we have. And then next week, they're going to come on site with a bunch of national experts from around the world. And they will spend almost an entire week in Bucks County. We'll be doing what they call road tours. They call them something else, but we'll be doing 4 vans with Blue Zone leaders and local Bucks County community leaders, and we drive around the community for hours.
Awesome.
Yep. So they do all this assessment, and then we have keynote speakers or the keynote address both Monday night and Tuesday night next week. If folks want the details of that, again, bluezones.com, or you can go to the BCHIP website. It'll take you right to our local Blue Zone page, and you can sign up to come to those events. And then not only do we have the keynote addresses during the day, the senator's office and our BCHIP team have worked to identify key leaders in the community, and we'll be doing various focus groups. So there's focus groups for the restaurants, there's focus groups for our community benefit organizations. There's also not just restaurants, but farms and the food pantries, all those folks coming together around food access and barriers. And the grocery stores too, can't leave them out. So they're part of one of the focus groups. Then we have a lot of the local township and municipality and borough folks coming together to talk about their plans. We have the health systems coming together. We have a school focus group, a civic focus group. So, and there's a few others. So there's a lot, there's a lot. So they're going to be meeting, and then there's also some one-to-ones with folks that either couldn't come to a focus group or have like a one-off situation. We're doing a one-to-one, particularly, like for instance, for the Y. You mentioned the Y already, and Zane and his team do a great job there. So they're coming to some of the focus groups, but we're also doing some one-to-ones with folks like Zane. So they will be on site for the week, spending a lot of time with the leaders of our community and various sectors of the community. And there will be some follow-up throughout the month of August for groups that we've missed or things that were identified. We'll do some more meetings. And then in November, they will come back and they will give us the results of their assessment and recommendations for next steps for us to start bringing some of those Blue Zone principles to the community members here in Bucks County.
Wow. So it's probably going to say something like, stop eating so much fat. Or I was hoping that when you first told me about this whole grant and the fact that, the senator had gotten the money, I was like, oh my gosh, can I take kickboxing? Like that was my first knee-jerk reaction, right? Can residents of Bucks County take kickboxing? Please, please, please. Like I would love to do that, right? But it's really going to first start to be what's here for us.
Mm-hmm.
Okay, great.
Yeah, so that's the first step. I think it's going to be very comprehensive. I like to joke. I said whatever they come back with as far as a plan, I think will guide the work for health and wellness for probably the next 20 years. I think I'll be retired before we actually probably see the end. At least God, I hope so. But we are excited to have something this comprehensive to kind of use to guide our work. And again, like I said, I think even though the work is currently focusing on District 10, I don't see it not being parallel to the other communities within Bucks. And so I think we're going to be able to utilize it as a tool across the county. And I'm pretty excited to see what comes out of it so that, there will be low-hanging fruit, I think, and then there will be some, much higher lifts, such as, sidewalks everywhere in Bucks County.
Right, bike trails.
Right. So I think there will be some things that will be easier that maybe, getting the restaurants engaged in Blue Zone menus and things of that sort. We have folks already interested in doing some of that work.
Sure.
So I think that stuff might be, some policy change and implementing some of those things could be kind of easier to do and could make a difference in our choices for health. But then I think some of the other things will be certainly much longer term goals and bringing that work forward.
That's great. And I mean, one of the great things about you and the team at BCHIP that you do is you identify gaps and then you look to go after them, right? You look to solve the problem, whatever that gap may be, staffing in healthcare, or now you have the long-term care partnership because you're like, look, we're getting old here in Bucks County and our current long-term care facilities may not be enough to handle what we're going to be bringing to the table for them. So your team is working on those. You guys have worked on, the COVID vaccines, even things like Sharps boxes, right? I mean, you sit in the center of those things. So if you see a gap that you can fill, like my kickboxing classes, for instance, I can.
So noted.
That's going to be a common joke. Steve's going to be like, why is Gardella talking about kickboxing classes so much? Like, that sounds like a personal goal, Jen. Go and figure that one out on your own. But seriously, like, fun ways to get moving, right? I mean, that
Yep.
would be important to me. So anyway, yeah, that sounds great. And I think that you and your team can use the data in so many different ways.
Yeah, it's an exciting project. And boy, the interest, I will tell you, it's really been amazing. The response we've gotten from everybody the Senator's team has reached out to, and then some. Just folks reaching out to me saying, we saw the town hall, because we've had several town halls. We've had
Right.
some other initial meetings, a steering committee meeting. There was a press release about it. And our emails are blowing up. A lot of people reaching out saying they're interested in this project and they want to be engaged, from physicians to restaurant owners to to farm owners to it's really interesting to see the number of folks that have heard about it or interested in it and want to be engaged in the work. So it's exciting.
Yeah, and I mean, I don't have the numbers in front of me, but let's face it, we're not exactly a healthy population over here on the other side of the pond from Europe, right? So look around and people want to be healthier. In general, they want to be living healthier lives, and especially in the mental health space, right? So, those feelings of connection are so important, as is getting out, moving your body, and not eating so much ice cream, which is my current issue because it's 100 degrees.
I'm trying to substitute ice cream for watermelon. Did that today, as a matter of fact. So,
How's that going for you?
day one is great. The watermelon's delicious.
It's been 15 minutes. I'm not hungry at all. Awesome. Well, okay. So any final words? I mean, it was pretty comprehensive.
No, it was. I would just say, if the keynote addresses next week are open, and folks are invited to attend. So again, if you need to, go to bchip.org and you can see the Blue Zone Ignite page there. You can sign up for those events if you'd like to attend. And we hope that we will be sharing more messages about Blue Zone on our interviews again in the future. So thank you.
Awesome. Okay, Kim, thank you. We'll see you in 2 weeks.
That's great.